Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health, and we are here today, Tuesday, February 23rd, with your opportunity to get your COVID questions answered. As always, you can put them directly into the box below on Facebook. You can also use the hashtag AskDrArwady on either Facebook or Twitter, and we will be taking your questions live. But first, as always, let's go ahead and turn to the dashboard because the news continues to look really good here in Chicago. Chicago.gov/coronavirus is always your one-stop shop for everything related to COVID, and you can also get directly to the dashboard by going to chi.gov/COVID-. So when we pull this up, first of all, look at that number on the top, 3.2%. 7-day rolling average test positivity. That is the lowest test positivity we have had since the COVID outbreak began. You can see here on the right, even over the summer, the lowest we were getting was about in a 3.8, 3.9 range. And this is compared to a peak of about 16% positivity at the top of the second peak and over a 30% positivity at the top of the first peak when we didn't have a lot of testing available. Our daily testing average continues to be right around 10,000 tests a day, well over what we need to be testing to make sure we have adequate surveillance. The number's down a little bit, reflective of the fact that we're seeing fewer cases, fewer people having symptoms, fewer people having exposures, but we have done more than 3 million tests here in Chicago, and that's what these numbers look like. And then look at our cumulative case number. So we've had about 242,000 COVID cases diagnosed total here in Chicago, and our average is down to 257 new cases per day. I'm really pleased by that improvement. Really, the cases per day is the one that's the most reflective of what your risk is. If you're out, if you're gathering, it's our case count that is the most important number there. The percent positivity is also important, but it reflects how much testing we're doing. They both do, so that's why you have to look at them in comparison. And one important thing to note is that sometimes, pretty often, we get the question is the case count down just because testing is down? And so this is where you can compare against the prior week. You can see that actually our daily case average is down 26% from a week ago. We were averaging 348 just a week ago. And then in contrast, our testing average is also down. Some of this is the snowstorm, but it's down about 16%. So we continue to see cases drop faster than we see the tests drop, and then the positivity being low also is reassuring. So if we take a quick look over on the daily by demographics, you'll also note here we've had 4,930 deaths per day. We're averaging 6 deaths per day right now, which is still higher than over the summer where we were seeing 2 to 3 deaths a day, but has come down from a peak of almost 25 a day in the second surge and almost 50 a day in the first surge. So deaths always lag, but the hospital numbers, everything is heading the right direction. We also got some questions about where do I find vaccine data? So I thought I would show you. If you click on vaccine here, you can also get here directly by going to chi.gov/COVIDVAX, VAX, and you can see, if you want information about how to find a vaccine, if you want information, if you live in Chicago for individuals, employers, healthcare workers, essential workers, or seniors, information here for providers. If you want to sign up to be a provider, if you want to get health alerts, communications toolkits. You can see data here. Equity related to Protect Chicago Plus, our COVID vulnerability index. We again this last week had at least half of the doses going to Black and Latinx Chicago residents, which we're proud of. That was our first benchmark from an equity perspective. 59% of Chicagoans are Black or Latinx, and obviously those communities have been the hardest hit from COVID. So we've been working hard to improve the uptake in those communities, make sure we're dropping barriers, and thanks to all the partners working on that. Also under resources, lots of things here related to communication tools, vaccine basics, frequently asked questions. We take questions you ask on Facebook and turn them into questions on this website. Information from our scientific COVID-19 vaccine work group. This is the group of the independent experts across Chicago who have come together when a vaccine is approved. They weigh in. to make sure that the process looks good, help answer questions. They will also be gathering informally to give some advice after the FDA advisory group meets on the 26th. Assuming that the Johnson & Johnson vaccine gets the emergency use authorization, the CDC Advisory Committee on Immunization Practices will also be meeting probably this weekend, assuming that everything checks out, and we may start to see Johnson & Johnson vaccine in early March. Also, finally, under updates, this is where you can get Chicago updates related to press that we put out, national updates. And then finally, over here on data is where you can see information about allocation, essential worker maps, and then vaccination data. And then when you click on vaccination data, we continue to work on making this more user-friendly. But first of all, under administered citywide, way down at the bottom here is where you can see how much vaccine has been administered in Chicago, whether it's Chicago residents, non-Chicago residents. And the good news, if we click on this and sort of pull down, first you can see this really continues to grow, and you can look and see that as of what has come in, we've had more than 527,000 vaccine doses administered here in the city of Chicago. So I know people saw the news that in the U.S. we've crossed that 500,000 death mark from COVID. You know, really, really sad. But we have also crossed, on the plus side, the 500,000 vaccine doses administered just here in Chicago, and across the U.S. up over 50 million, over 52 million doses administered. So rollout continues to go well there. You can also look, if you just want to see Chicago residents, you can click here and get a sense. This is where 11.2%, so more than 1 in 9 Chicago residents has gotten at least their first dose, and 4.7% of Chicago residents, so coming, it's probably about 1 in 21 off the top of my head, 1 in 22, have gotten both doses. And you can click and see what that looks like over time. But then also you can explore here if you're interested. We can look at things like the maps. So here we have administered by zip code. If you want to take a look and see, for example, in your zip code in Chicago, this one is just the first dose, but you can also look at the second dose. And if we pull it up here, you can see that you can hover over the map and it will tell you for that zip code the number of doses that have been administered, as well as the percent coverage. And so I just want to highlight 60639 here, which is where Belmont Cragen is. This is one of our Protect Chicago Plus communities that's been one of the hardest hit by COVID, where we've had some really dedicated vaccine events working with a number of partners. In particular, over the weekends, there have been big, dedicated vaccine efforts, which Oak Street Health has been the provider for, and they've been held at Steinmetz High School, have done, a couple of thousand dedicated doses each of those weekends for that community. And so you can see we've moved here to a point where there have been more than 8,700 vaccines given, and we're at 9.9% of the population. Which starts to bring it into this darker blue. Our goal is that our Protect Chicago, the south and west sides here, we're working to really bring these communities, in line with some of the ones on the north side. You can see here, it's more like 10,000 and 11%. So still a ways to go, but really seeing some nice improvement. 60632, 60629 here, 2 other of our very hardest hit communities from COVID are now in the 8.8%. With 7,000 to 8,000 first doses of vaccine. So some really good progress. And again, thanks to all the partners. But you can see there are areas to go here. These lightest colored ones, Englewood and West Englewood, Protect Chicago Plus initiatives are getting going there. And really the 15 community areas that have the highest COVID vulnerability index, like we described previously, are where we are doing additional dedicated vaccination efforts. These are settings we have to really get additional vaccine into, not just because it's the right thing to do, but because these communities have been harder hit, and then we tend to see more circulating COVID. And so if we don't get good vaccine coverage, we actually increase the risk for variants, increase the risk for COVID numbers. And one of the reasons we are seeing such nice improvements in our COVID numbers is because we're starting to see some impact of COVID vaccines, particularly in those hardest hit areas, in the nursing homes, in the homeless shelters, in the in the jail, in some of the congregate senior facilities, the developmentally disabled facilities, places where we've been pushing vaccine, in addition to some of the harder hit communities where we're working to really get vaccine in. A big part of the strategy here is equity, not just because it's the right thing to do, but because it in turn does decrease the risk for everybody from COVID, and particularly related to variants. So I encourage you to continue to explore. You can look by age. You can look by age, you can look by race, ethnicity, you can compare our cases and our administration, but this is where the data lives, and we had some questions on that. So let's go ahead and turn to your questions. All right, right off the top. So our vaccine dose is still delayed. So let's do a quick update on that. So as a reminder, with the big storm that hit not just Chicago, but much of the country last week, we did see some delay in COVID vaccine arrival here in Chicago and really in every state. And the main way that this hit was that usually our vaccine doses arrive Monday, Tuesday into Wednesday of each week. And because of the storm, they got pushed back. So instead, they more came in the Wednesday, Thursday, Friday timeline. We had gotten all but three of the shipments across the whole city, and we get about 160 between all the providers, give or take, in a given week. We'd gotten all but 3 by Friday, and those other 3 have now all arrived. We were also concerned that we might see a little bit of delay this week, in terms of making up for all of that extra shipping that had to happen. But actually, we got a notice today that all of the vaccine shipments are back on track for Chicago. So thanks to everybody. Really, this is a lot of work from the people working in the warehouses to the people working on the shipping to really make sure that we could get back on track. And my team here, just so you know, we work really hard to make sure that we are getting our vaccine orders in immediately. There's a time frame. You can put your vaccine order in over a number of days. We get it in right at the beginning because the way that the shipping works, it's sort of first order in, first order out. And so in case there are weather delays, having our vaccine order in just as soon as possible helps mitigate some of that. And I've got staff who stay very late on the night that the vaccine orders are due to make sure we can be one of the first jurisdictions to get those orders in. So we are looking good there. Next question, Jen Parks on Facebook. How well are vaccines working in the real world? Are vaccinated people spreading the virus to others? Oh, really good question. And some of you have probably been following the data on this. And as you know, this has been really one of the most important questions. The news on these vaccines honestly could not be better. All of the data that is starting to come out related to how the vaccine is performing in the real world is showing that it is on track with, or in some cases even outperforming, what we saw in the trials. Some of the best examples of this, so you've probably seen some of the news out of Israel, and if people are interested, we could talk some more about Israel. Israel agreed to give Pfizer access to its countrywide data in exchange for some sort of earlier access and more access to vaccine. It's a relatively small population, only about 9 million people, and so recognized as a good setting. They also have one universal electronic health record, so can more easily really get vaccine to people in an orderly way. And they've got about half the population at this point. That is, I think it's 46% last I looked, that's got that first dose in. And the vaccine in the real world absolutely has been shown to be protective, not just for the individual who's getting it, but it has also shown to decrease the rates of COVID infection. In others, continues to really perform beautifully in terms of preventing severe outcomes. And then I think just yesterday, I read there's a preprint in Lancet. And just for some background, so the Lancet is one of the sort of most important medical journals, and a preprint means a journal article that has not yet finished the peer review process. So that means experts are still looking at it. They may be requesting some data. There may be some minor changes to it, or it's possible it wouldn't get published. But generally, if a preprint is put out, especially by a journal like The Lancet, it suggests this is going to be data that's coming out very soon, and there's sort of important implications to getting it out even in that preprint form. So I want to just put a slight caveat that it's not fully published yet. But you can look for it. It's publicly available. And I just was reading it this morning. The author on it is Hall, Dr. Hall, and it's the SIREN study, SIREN. And this has been an important cohort study in the UK where they enrolled more than 30,000 healthcare workers who volunteered throughout really recent COVID times, first of all, to get tested for COVID, to get a PCR test every 2 weeks for COVID, even if they don't have symptoms. So they've been testing them every 2 weeks, right, looking for asymptomatic infection. And actually, a lot of them also are getting twice a week the more rapid tests. So there's been a lot of testing in this population, whether they're symptomatic, asymptomatic, so a really good sense of what COVID infection. Because these are healthcare workers, they're obviously at higher risk in terms of more exposures. And so you've got this big cohort of people, and about 23,000 of them they had enough data for the study. So vaccine rolled out. The UK is basically on the same timeline that the US is. And by early February, 89% of this group had been vaccinated. And some of them were post the first dose. Just a fairly small number, there had been enough time for them to be post the second dose. But what they saw was that in the unvaccinated group, like in the group that had not yet gotten a vaccine, or there were some people who chose not to get a vaccine, in the time that they were following, they had almost 1,000, more than 900 COVID diagnoses. So people continued to get COVID in the unvaccinated group. But in the vaccinated group, in people who were at least 21 days after that first dose, right? Remember, the first dose is still only partial protection. This was Pfizer vaccine for the most part. They saw 71 new infections. So instead of 970 something infections, saw 71 infections when you control for the number of days people were vaccinated or not. And then in the small group that had gotten the 2 doses, they were only able to look 1 week post the second dose, and we technically consider 2 weeks post the second dose full coverage. But they saw only 9 new infections in that time frame. So this basically, what they were concluding was that even after the first dose, in this population, which are people who are healthy enough to be working, there's probably some selection bias in terms of people who sign up for the study. Even after the 1 dose, it was in the sort of 70% protection range, not just for symptomatic, but for asymptomatic infection, right? They were swabbing everybody. They were not finding people sort of carrying COVID, meaning these people then are not able to spread it. So about 70% protective after that first dose, and then about 85, 86% protective even a week post that second dose. So in the real world, really, again, very reassuring data that this vaccine is protective. Not 100%, right? Like there were still a very small number of people who did get the vaccine even a week post the second dose, which is why, while COVID numbers remain high, you have to continue to be masking, you have to continue to be doing these other protective things. But a vaccine that performs in Israel and in the UK in the real world like this absolutely backs up what we saw in the trials. And this is a vaccine that will get us past COVID. The other important thing about the UK, their dominant strain at the time this was done is the UK variant. It's the B.1.1.7 variant, which is known to be more infectious. And so the fact that even with that more infectious strain, you see the vaccine performing really right on par with how we would expect it to, is very reassuring that the vaccine, remains protective against that variant. So really good news, and again, just for me, a note that making sure we continue to have the really good efficiency, equity numbers, getting this vaccine rolled out in Chicago as quickly as possible is going to be what helps us get past here. Nothing surprising in the U.S., in the UK, in Israel, anywhere. We've done hundreds of millions of doses at this point. No new safety concerns, no new efficacy concerns. Continues to be a very safe, very effective vaccine. So yeah, that's good. Chell Bowers on Facebook, is the infection rate 3.2% because of much less testing? So that's the question that I answered a minute ago. In fact, if we were doing, so let's take this question. The percent positivity takes the number of positive tests divided by all the tests that are done. So actually, if your testing rate is going down, your positivity rate can go up more likely, if that makes sense. Because say you're testing, if we take sort of round numbers here, let's say we went from testing 100 people and we found 3 positive, that would be a 3% positivity. And we dropped it down, and instead we were only testing, 10 people, and you found 3 positive. You would then have a 30% positivity instead of a 3% positivity. So actually, the drop in testing accompanied by a drop in percent positivity is doubly reassuring to us that this isn't just a change in testing. This actually is lower numbers of people with COVID in the group that we're testing. So I hope that makes sense. And then Shell is asking as a second question, what's the status of the J&J one-shot vaccine? February 26th, FDA is going to review it. We expect there will be more trial data available shortly before that, judging what we saw from the other vaccines. And so I imagine next week we will be sharing in a lot more detail on Facebook everything that we know out of those trials. They follow not just the top line numbers in terms of how safe and effective it was, but they look at subgroups, different ages, different underlying conditions. They look at side effects, lots, all kinds of things. So we'll have a lot more to share there. But again, FDA first has to look at it, decide to grant emergency use authorization, which I do expect given everything that we've seen. And then the CDC and the Advisory Committee on Immunization Practices reviews it. That could be as soon as this weekend. And then once they recommend it for use, that's when it would potentially start being shipped. And we are already planning for it to be here as soon as early March. Don Wolf from Facebook, how concerned are you about the newer, more infectious variant? How does it impact reopening decisions? So there are a number of different variants, and if you're interested, I encourage you to read about this because it's one of the more interesting parts, I think, of COVID, and it is in a lot of ways the biggest unknown. There are 3, I would say, variants of concern, we call them, that have raised the most attention at this point. One is the B.1.1.7, the one I was describing that is now the predominant virus in the UK. It's also the one here in Chicago we've seen the most cases of. We've only detected about a dozen cases of it here, about twice that across the state, but it's here for sure. And that's the one that is thought to be more infectious, meaning more contagious, but the vaccine continues to be very protective against it, as we saw in this trial here. And that's that main concern. And then the 2 other ones we're watching pretty closely right now are the one out of South Africa. That one has been shown, particularly some of the vaccines, to have decreased effectiveness against that strain. So the Pfizer and the Moderna continue to be protective against that strain, but not as protective. Like it backs off a little bit. And then, unfortunately, the AstraZeneca vaccine, which we don't have here yet, but it was the one that they were planning to use in South Africa, really was not very protective. It was like less than 50% protective. And so South Africa actually stopped its vaccination campaign because they did not want to be vaccinating people with a vaccine that was not protective against that variant. That's the kind of thing that makes me the most concerned. If we were to see variants emerge that the vaccines were not protective against. And the third one is, and we've not had one of those detected here in Chicago, but there have been a few in the US. And then the third one that we've been watching closely is out of Brazil. And that one, again, looks to be more contagious, and there's some questions about whether it may be more easily able to reinfect people who had COVID before. So we're still learning about these, but they're here. And we have done a lot of work here in Chicago or across the country, first to continue to build up our ability to test for these and to monitor for them. And thank you to the many academic centers that are working with us on that. The Chicago Department of Public Health also puts a lot of extra emphasis on any cases that are detected with one of these variants. So we do, we always do case investigation and contact tracing, but especially for these, we'll do sort of another level, really understanding where people may have been infected, who their contacts were, do additional testing around them. But we also are doing what's called surveillance, which is when we look at data patterns and we're watching, for example, anybody that we see here in Chicago who gets COVID and had a prior COVID diagnosis, like in the past, where possible, we're looking to try to compare, were these different, strains, was there anything different going on there? It's not a lot of people that we see looking like there's been some reinfection, but we again do extra work on anyone that looks like there could have been reinfection. And then secondly, wherever we're seeing people have a COVID diagnosis after they've gotten the vaccine. Typically we see that after just the first dose of vaccine. It's not 100% protective. And again, it's rare for people to be getting COVID post-vaccination, but it does happen occasionally. And those would be people we would want to check and make sure, did they have a variant? Was there something different about their COVID? So that's some of what's going on behind the scenes to track this. But the good news is that with our numbers, the way they look right now, fewer than 300 cases a day, although I want to get us down under 200 cases per day. Very good testing access, low positivity. Our emergency department numbers are also for COVID-like illness are the lowest they have been since COVID started, which also lets us know it's not just testing. And our hospital and ICU numbers really dropping every day. We're getting down toward lower risk territory with all of these indicators. 2 are in lower risk and 2 are in moderate risk. The good news is that we're not giving the variants a lot of opportunity to take hold right now, and we're not giving them a lot of opportunity to spread. The reason why we have to push vaccine into the settings that are most driving our outbreak again is because this is how we limit the risk to everybody of variants emerging and of spread. And so I feel very good. We looked at this with the modelers also, that at least for these next few months, assuming people please continue to do the things that have gotten us this far, wear those masks, do the social distancing. COVID is not over, even though our numbers look better, even though vaccine is in the picture here. As long as people can continue sticking with these practices, and as long as we continue to have a really good positive vaccine rollout, which we have, I'm really confident that we will not see significant issues related to this vaccine in the short term here. And then if we can get more vaccine, even more people vaccinated, I'm feeling confident at the moment that with the current variants that have emerged, we're in good shape. My longer term concern, to be honest, really has to do with global vaccine equity. So, right, the US has done more than 50 million doses of vaccine. Most countries around the world have not even started vaccinating. And you think about countries that are lower income, have fewer resources. COVID is there too, and it is spreading in some cases fairly unchecked. And that's the setting where you may see variants emerge. And so it's going to be really critical for, again, not just the right thing to do, but from a global security, US security perspective, that as soon as we're at a point here where we've got good vaccine access, for everybody in Chicago, everybody in the US, which is going to be over these next few months. It's going to be very short term where we're at a point where everybody's going to be able to get a vaccine. I feel confident about that. It's going to be really important that there's an international effort to make that same thing happen around the world, because variants that emerge in other places can show up here. And if we were to have a variant that the vaccine is not protective against, again, we don't have that right now, but if we had one emerge, that, you could imagine having to sort of start over again, and that's the last thing anybody wants to do. So that was a long answer, but it's a complicated question and just so interesting related to how these variants are emerging and what we can do from a public health perspective to cut that risk. Joanne Palmer on Facebook, how many doses is Chicago getting a week now? All right, good question. So we have this available on the website. So this week we are getting, I always think of it as first doses per day because that's how we divide it up. We're getting 8,300 first doses per day this week. So 8,300 times 7, whatever that is, 57,000 or so is how many we're getting in the week. That's first doses. We do get second doses that come along, to handle the people who we did 3 or 4 weeks ago, but those don't give us the ability to vaccinate more people. So that's not typically how we talk about it. So we're getting 8,300 a day. first doses. That is up again. Just last week, we were getting around, in the 7,000 range. The week before that, we were in the 6,000 range. The week before that, we were in the 5,000 range. So it's been going up each week, and I've been pleased to see that. But again, for some perspective here, if we're doing, 7,000, 8,000 a day, there remain more than 700,000 people who are eligible in phase 1B in Chicago. So I did the math, and if including all the vaccine that Chicago is receiving this week, like the current week that we're in, by the end of the week, we'll have received enough to vaccinate 31% of the people eligible in phase 1B. That's our 360,000 people over 65 and our 350,000 frontline essential workers. 31% since the beginning of opening 1B. So every week it's getting more, but that is still the answer to why not everybody's been able to get a vaccine. And there's a bunch of questions in here. That's partly why I'm going into some detail. 1 in 9 Chicago residents, 1 in 4 Chicago residents over 65, really good progress, and we could be doing more as soon as we get more vaccine. But that is still the main thing that continues to be the rate limiting factor. And the efficiency data looks good. We were over 90% again this week in terms of having vaccine into arms and reported 7 days after delivery. So we're beating those efficiency goals. Again, above the 50% of the doses going to Black and Latinx residents, so hitting the equity goals, but we're just needing more vaccine. All right. Irish McMill from Facebook. Why are first responders still waiting for doses? So I don't know what your background is, Irish, but we have made, if you're in the city of Chicago, if you are in, for example, the Chicago Fire Department, the Chicago Police Department, Chicago EMS, we have made vaccine available to all of those individuals through dedicated points of dispensing. So we've also worked here in Chicago where there are private EMS providers. Those folks have also been vaccinated. So my guess is you may not be in Chicago, or I'm not sure. So but if there's a Chicago-based first responder, you should check with your employer, because what first responders were in 1A, and we have worked hard to make sure that everybody who was eligible there got vaccinated. Denise Jones on Facebook. Why is it so hard to get an appointment for eligible individuals? Again, it just comes down to numbers, Denise. We've gotten 31% of the vaccine that we need to make vaccine available for everybody eligible in 1B, not even including those in 1A. That's also, I see questions here about opening up. It's why we've not been able to open up yet. And Cynthia Dixon's question, why is the city of Chicago not following the rollout plan to make the vaccine available for those 60 and older with underlying medical conditions? So it's not just the city of Chicago. Thank you for this question, Cynthia, because we've got a few variations on it. So the CDC has defined pretty clearly when you should move ahead to the next phase. And it all has to do with, are all of your appointments, do you have appointments going unfilled, right? You get to a point where 80% or less of your appointments are not filled, where there's any vaccine that's not going to use, et cetera. That's when you should be moving ahead to the next phase. I also want to be really clear, because there's been some mixed information about this. The CDC has not recommended a change to its 1A, 1B, 1C guidance. The outgoing administration, there had been some verbal comments about potentially expanding, but there has not been guidance from this administration in writing or from the CDC recommending that there be an expansion at this time. So we continue to follow CDC guidance on this, but really the main thing is that we're following our numbers. When we open up vaccine appointments, thousands of them are going in, like literally in seconds. And clearly there are we've only vaccinated 1 in 4 Chicago residents over 65 65, right? Even setting aside the essential workers. And it's the same in Cook, in Evanston, et cetera. And so it's not just the city of Chicago that said, we're not ready at this point. The city of Chicago, Cook County, Evanston, DuPage County, Stickney, there may be others, all said, we're just not at a point to be able to move ahead. It seems like there are some rural areas in the state that may have been supplied more vaccine. They may not have as many people. They may have gotten through a high percentage of their people over 65 and their essential workers. My feeling is primarily from the state distribution perspective, you'd want to then direct vaccine perhaps up to the Northeast where there's a larger population group. But regardless, if there are parts of the state where you have vaccine going unused, certainly it would be appropriate to potentially move ahead at that point. But that is not the case here. So we will be moving ahead for sure as soon as we're able to. And if we get additional vaccine, significantly additional vaccine, it may be sooner than expected. But that timeline that we laid out actually continues to look pretty consistent with our numbers. If you recall, we really said the end of March 29th was where we were guessing we might be at a point to be able to move ahead into 1C, and then the end of May when we might be able to move ahead to phase 2. And I haven't seen anything that really suggests major differences from that. I think if we do get a lot more vaccine in March, maybe more than we were expecting, is it possible we could open up, providers to start doing existing patients who are, have underlying conditions? It's possible. But we've got to make sure that these highest risk folks are first getting the access to vaccination, because right now the epidemiologists had done some analysis. There's about more than 950,000 Chicago residents who would probably become eligible under those criteria for underlying conditions. We cannot add 1 million people to the about almost 1 million people, including the 1A, who are already in competition for the existing doses. It'll just make everybody more frustrated. So as we have more vaccine, we definitely will be opening up and go from there. All right, it looks like we are basically at time. Okay, one more question here. Oh, okay, let's take this one. Allie Haverson, do you anticipate any changes to the travel order based on vaccination status if data continues to show reduced rates of transmission by vaccinated individuals? Yes, and in fact, we put out an update to the travel order just this morning. First, there are a lot of states that are doing so much better, just like we are here in Chicago. And there were, off the top of my head, something like 18 states now that are back out of that phase orange, where you need to get a test or where you need to quarantine, and have come back into the yellow status where you still need to take precautions, but you don't need to do extra testing or quarantine. So that's good progress across the country. But also, we were explicit about the fact that for people who have been fully vaccinated, meaning 2 weeks post your last dose, 2 weeks post the second dose if it's a 2-dose vaccine, 2 dose past the single dose if we have a single dose vaccine authorized in the future here, and you're not having any symptoms, you also do not need to quarantine, do not need to do the testing if you travel. It is critical, though, that post-travel or post an exposure of any kind, you continue to monitor your health for 14 days. If you start to get any symptoms consistent with COVID, you have to self-isolate and get tested. And it's also really critical, again, whether it's after travel or whether it's after an exposure, people have to keep doing the masking, the social distancing, these things that help protect everybody. But yes, thank you very much for that question, Allie. It's one of our, we feel really confident about the vaccine data, and so does the CDC. So good news for everybody that in addition, as you get vaccinated here, fully vaccinated, you'll have some more opportunities to be able to travel, still taking precautions, but we know that the risk is lower. So thank you. I think in terms of some good news, launched a new vaccination site at Lawndale Christian Health Center yesterday. That's another one of our Protect Chicago Plus initiatives, and thank you to Lawndale Christian for that. This afternoon at 1 p.m. we are doing a press conference especially focused on some of the work related to vaccinating people who are experiencing homelessness in Chicago. We'll be at the Pacific Garden Mission with a lot of partners, and I encourage you to tune in if you'd like to hear some more about that. Chicago is really, in a lot of ways, leading the country in terms of efforts that we've been making with partners to make sure that that group has had access to testing, to supportive housing, and now to vaccine throughout the pandemic. So would encourage you to tune in at 1 if you're interested. And then finally, I know some people saw this in the paper, but we are really, really pleased to announce in conjunction with the Chicago Parks District that we're going to be able to reopen the parks, the Lakeshore Trail, the playgrounds. I know it's the middle of winter, but we are at a point where we can absolutely do this. And again, feeling pretty good about the way we are heading into hopefully some warmer weather soon, and wanted to make those decisions and get that cleared sort of now. So we do need people to keep wearing the mask, keep doing the things, even when you're gathering out of doors. But really, excited to announce this Friday some good steps in terms of moving forward. So lots of good news. Thank you very much for tuning in. We'll be back on Thursday at 11 Central if you have more questions. Good questions today, and if we didn't get to them, we'll try to get to them online or get to them in the future. So we'll see you on Thursday. Please keep being safe, and thanks for tuning in. Bye-bye.